Greetings from Washington, D.C. This is Peter Thomas, General Counsel of the National Association for the Advancement of Orthotics and Prosthetics. Death by 1,000 cuts. It's perhaps a little bit dramatic, but it describes what CMS and the OIG and Congress continue to do in the Medicare auditing area, and it really continues to be alarming for the survival not only of orthotic and prosthetic professionals and the field as a whole, but of all of healthcare providers across different settings. Just this month, CMS issued a number of proposed rules and new guidance. The OIG announced a number of new reports that continue to be alarming and concerning for the field. The first is a proposed rule that ultimately gets to the issue of disenrollment and allows CMS to disenroll O&P practitioners, suppliers, if in fact they have a pattern of high error rates. And this is despite the fact that those very same providers might be appealing those initially denied claims. And so what this proposed rule really does, in our view, is subvert or obviate the appeals process, which is authorized by regulations in Medicare law. That's a problem, and we've said that. We've submitted comments along with the O&P Alliance, and we'll push back on that provision very strongly. In addition, the Office of Inspector General issued a report on surety bonds and basically stated that in the DME-post area, CMS is not, and its contractors are not exercising surety bonds to the extent that they should. In fact, CMS is beginning to respond to that, and its contractors are collecting on surety bonds to a greater extent in the very recent past. At least anecdotal evidence suggests that. In fact, we're aware of situations where Medicare contractors have collected on surety bonds, even though the providers in question have repaid part of the claim. And according to Medicare regulations, the contractors are not supposed to exercise surety bonds in that instance. Again, we have NAOP, along with the O&P Alliance, has commented on that development as well. And finally, in terms of the third kind of peg to drop, CMS ultimately has moved forward with an MLN Matters article that talks about the ability to deny enrollment to a provider who owes an overpayment to the federal government in the way of a Medicare debt, even though that overpayment may be in the middle of the appeals process or have a stay of recoupment currently being employed. We think that, again, this obviates the appeals process and diminishes it, and really is contrary to existing Medicare regulations. So these are problems, and we're responding to them as actively and aggressively as we possibly can. In light of that, it's very, very good news that the Senate Finance Committee recently held a hearing where they interviewed a RAC. One of the witnesses was a recovery audit contractor representative, as well as two representatives of providers. And the testimony and the comments and questions from the senators on the Finance Committee was extraordinarily interesting. In fact, every single senator except one expressed serious concern that the RACs may be too financially incentivized and may be going after legitimate claims ultimately for the purpose of just building their profits. In fact, an OIG report recently stated that 60% of claims that are appealed to the ALJ level are overturned in favor of providers, and that was of great concern to almost all the senators on the panel. I wanted to read one quote to you from Senator Hatch, who's the ranking Republican on the Senate Finance Committee. Senator Hatch stated during the hearing, "Such a high rate of reversal raises questions as to whether RACs are being too aggressive or do not understand current medical practice." That's a pretty good indication that there's a growing sense that the RACs are perhaps run amok and have used the financial incentives that they have been afforded by Congress in a way that they perhaps are being overzealous and ultimately for the benefit of their bottom line. So we will continue to keep on this and do all we can to make sure that the O&P field and providers, suppliers, and practitioners are well represented in Washington. Thank you very much.